Good evening. It is December 1st, believe it or not, can't believe it, but it is. It is 5:15, and this is the regular meeting of the County Commissioners. Would you stand with me, please, for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioner Michael, I believe he'll be here in a little bit, and Commissioner Larry is absent. Okay, we have finalized preliminary budget. I'm not.
No,
a
that's
mistake,
supposed
isn't
to
it?
have been off the,
Okay,
that was
thank
on
you. I
one of the other
don't
times.
know
and
what that is.
Sandy
so-
keeps forgetting to take it off.
Yeah, I was gonna say, we already did that.
Yeah, thank you. No, we're done. We're done. Done. Accept and approve the waiver of the reading of the minutes. I'd like to propose one change, and usually things like this, I don't worry about, I don't make a big deal over, except for the fact I've been very vocal over the fact that I don't make motions as the chair, and it has for the treasurer's report that I made the motion, and it was seconded by Commissioner Michael. I believe that was Commissioner Kelly that made that motion, and
I agree with that.
so, anything else on the minutes? If not, we would take a motion to accept them.
So moved.
Second.
Okay, all in favor? Opposed?
Can I ask who seconded that?
And Commissioner Floyd, or Floyd. Okay, review and approve all bills, part-time deputy payroll.
Madam Chair, I make a motion to approve payroll manual warrants 2144 and 2219J.
Okay. Any discussions or questions about the payroll or warrants? Okay, all in favor? Opposed? And let the record reflect, it is 5:17, and Commissioner Michael is with us.
Madam Chair?
Yes.
Actually, I arrived here at 5:15.
All right, 5:15 it is.
The clock says 5:20 or something.
We started earlier. Apologies. Before we go on to the reports, does anyone have any objections if we go ahead and let the two organizations that are here with presentations go out of order, and then later we'll go back to the ARPA? Okay. Could we hear from Trinity Jubilee Center presentation? You're welcome to come up and use the podium. Just give us your names and where you're from, and we'll hear your presentation this evening.
Handouts that I can pass around.
Thank you.
Thank you.
So my name's Erin Reed. I'm the executive director at the Trinity Jubilee Center. This is Clara Tammany. She's the senior warden at Trinity Episcopal Church. And Tom Platts is here with us as well. So I just wanted to introduce our programs, what we do, the need we're seeing, and then the project we have to propose. So we are a community center in downtown Lewiston. We operate out of the Undercroft of Trinity Episcopal Church. We've been there for 30 years. We have 5 programs. The first is the soup kitchen. We do 100 to 175 hot lunches every day. 36 of those are picked up by Lewiston Housing Authority and delivered to homebound senior citizens. Among the folks that do come to us to eat, most of them are elderly. We have some folks that are disabled, homeless. We have families with young children. We cook all of our food on site. For a lot of folks, this is the only hot meal they'll get during the day. Our second program is the food pantry. We serve about 100 families a week. That's mostly working families, single moms. We do a lot of fresh fruits and vegetables. We also do frozen meats, fresh milk, non-perishable goods. We operate the only diaper bank in Androscoggin County, so anyone with a kid under 4 can come in every month and get diapers. Our third program is our day shelter. A lot of the shelters in Lewiston close in the morning, so we are a place people can come during the day. We also serve folks that are outside all night, often due to mental illness. It's a place people can just come in, use the bathroom, warm up, rest. Last year, we served about 170 people through the shelter, and we can get people connected with Preble Street caseworkers through their Veteran Services program. We can get people connected with mental health services. We get people from all sorts of situations. We had a gentleman last year who got released from the hospital and found out that while he was in the hospital, he had been evicted. We had a mom who, in the course of 10 days, found out her husband was having an affair, found out she was pregnant, had a breakdown, was out of work for several days, lost her job. Her husband got arrested for domestic violence, and she got evicted because it turns out he had not been paying the rent. So she was on our doorstep with her kids. And there are services out there, but it's hard to know what they are, where they are, how to get to them. So we're the only place people can come and say, I just lost my house. What do I do? And we can say, okay, you can do this and this and this. There's these programs. Here's our phone. We can help you keep track of appointments, and we'll be there for whatever folks need. We had a gentleman call us a few weeks ago who we had helped probably 2 or 3 years ago, and he was just calling to say, you know what? I just wanted to tell you that I really appreciate the help. I was in your shelter, I was coming to your soup kitchen, and I know you haven't seen me in a while, but I've been working full-time. I pick up extra shifts. I work 7 days a week. I'm on my lunch break, and I thought, you know, I'll give Trinity a call. So it was really nice to hear from him. The fourth program is our resource center, and that is services for the people coming in for food and for shelter, but also for anyone in the community who needs it. We have a free medical clinic every week, so anyone without insurance can come and be seen by a doctor, and we also have pre-med students. Folks can come in and use our phone, which has been really helpful during COVID with everyone's appointments being transferred to phones. Use our printer, fax machine, internet. A lot of folks that are homeless get their mail with us. You can come in and get winter gear, hygiene items. We do a lot of referrals to mental health services, Preble Street Veteran Services. Kind of help with whatever paperwork people have, if it's resumes. Last year it was rent relief. I had a little old man come in last year who, what I finally figured out had happened is that he got his Social Security benefits on a Direct Express card, and he had tried to make some purchase, and it had gotten flagged as possible fraud, and they froze his card, and he couldn't get his money out, he couldn't pay his rent, and all he had to do was take a photo of his ID and send it in to prove that it really was him and he had his card, and he couldn't do it because he's 86, and he can't take photographs that are clear enough. That's all we had to do, just take a photo, send it in, and he was able to pay his rent. We also work with a lot of partner agencies, so Head Start will come in to sign kids up. We had the Census Bureau come in, the Dempsey Center comes in and does cancer screenings. And then the last program is the Refugee Integration Program, and that's very similar to the Resource Center. It's just the same services in Portuguese, Somali, and French. With them, it's mostly resumes, job applications, immigration forms. Sometimes we get, my kid brought this home from school and I'm supposed to sign it, and I'm not signing this until I know what it says. Can you please tell me what it says? A lot of it is rooted in the era of you walk into a business and you talk to the owner about a job, and he's like, all right, start tomorrow. That's over. It's all you need a resume, you need to fill out this really long online job application, and people will come to us and be like, I know how to unload trucks. I know how to stock shelves. I don't know how to do all the computer stuff. Can you just help me do that so that I can get this interview? And we can do that. We can help people write their resume, find the listings, fill them out, schedule the interviews. So the general idea is you get people through today, like get them warm and fed and literally bandage their wounds, and then figure out where we go from here. How do we get you back into housing, back into the workforce, deal with whatever issues are causing you to need to come in and ask us for food. So we're open 6 days a week. We serve about 1,000 people a week. We have the area's only diaper bank, only free lunch, only free medical clinic. As far as I know, we're the only place you can just knock on our door and say, can you help me apply for a job? And we'll sit down with you and do it. We've helped over 1,000 people find jobs in the past 10 years. So the need we're running into right now is we're seeing a much bigger need for food. In October of 2019, we were feeding about 135 meals a day. October of this year, it was up to about 150. So serving more meals means you need to store more food. We're also running into issues of backup. We do a lot of food rescue, so we get leftovers from Bates and Hannaford every day. And we were operating on a day-to-day, fly by the seat of your pants, because we have no storage space. And when COVID hit and Bates shut down and Hannaford, I mean, everyone was like panic shopping, so there were no leftovers. We got slammed because we were not prepared. We had nothing in storage. So we need to be ready so that we can be self-sufficient when something like that happens. And we just need to be able to have food on hand for tomorrow's lunch. And our building is really not designed for food distribution. It was designed for like coffee hour in the 1800s. So none of the doors fit a pallet. When all our deliveries come in, they get dropped at our door and we cut the pallet open and you have to carry in every single box and then rebuild your pallets. We have fridges and freezers in every corner of the building, but we're still turning away food all the time. And we've had to turn most of our shelter space into food storage space. Over the past year, we had times where it was down to just 5 seats. We couldn't fit anyone else in the shelter because we had just tucked everyone in between these pallets of food and there was nowhere else to sit. We're back up to 11 seats as of last week, but Monday morning of last week, by the first hour, we had reached capacity and I had a mom knock on the door with her 4-year-old son. And we just had to rush and move an entire pallet of food on top of other pallets of food to make seating for them. So we're always at capacity. So our plan is, we want to put on an addition. It will give us another 1,000 square feet. It'll give us a garage door, food distribution space, food warehouse space, walk-in fridge and freezer, and then storage in the back. We have to deal with the wear and tear on this building, and we have to make it accessible. Our main entrance is not wheelchair accessible. It has stairs. We have no ventilation. We need more bathrooms. We'd like to create a public restroom that people can access without needing to come in and out of our shelter. We want to add a bathroom with a shower for our homeless clients. We want to add a washer and dryer, primarily for the homeless clients, but also for families in the area that can't afford that. We need to do updates to our medical clinic room. We'd also like to have it double as a space for caseworkers to come and do on-site meetings with their clients. So with this, we'll be able to feed more people, offer a public restroom, have more resources to get people off the street more quickly. So while we were thinking of all of this, the church was having a lot of conversations about what to do with their space upstairs. It is an aging congregation. They are wonderful, but there's very few of them. And if they continue on this trajectory, they may end up closing. And that would put us in a really tight spot. We would have to either take over the entire building, including the church, which is not very usable for our purposes, and we'd have to take on the cost of upkeep for the entire facility. Or we would have to just walk away and board up the building and basically do another capital campaign to start fresh somewhere else. So we talked to them. They are interested in giving us the building and turning the upstairs into a community space, performance venue, wedding venue. So the idea is it will generate the revenue to support upkeep of the building. So Clara is going to tell you more about what the church is doing. And then we are here for whatever questions you guys have.
My name is Clara Tammany. I live in Lewiston. I used to be the director of the Center for Wisdom's Women, and we made Sophia's House that opened a couple of years ago. I now live there as a resident mentor advocate. But I speak to you tonight as the senior warden of the parish. Trinity helped start the Jubilee Center 30 years ago, and also helped start Tree Street Youth, and kept the Center for Wisdom's Women open, so it has a huge presence in that neighborhood historically. Our goal as a parish is to bring the whole building up to code so that it can be usable long into the future, so that our history and presence of service in the neighborhood and to the neighborhood continues, both through the Jubilee Center, but also in a new and expanded ways upstairs, and do that whether or not we continue as a congregation. Boarding up the building for us is just not an option because of the historic mission that we've had in the neighborhood of service. So through focus groups last winter and other discussions, there seems to be a need for an accessible, flexible, mid-sized facility for events, programs, meetings, performances, and social gatherings such as weddings. A needs assessment with further research by Bates students will be done this starting January term to focus on the needs and identify possible partners, partner organizations, options for funding and managing the new space. Whatever the result, our hope is that it will become a widely used multicultural center that will be self-supporting for the Jubilee Center. And to make that possible, the diocese is willing, the Episcopal Diocese really owns the building, but they are very willing to transfer the deed to the Jubilee Center. And we're willing to let it go. So our vision is to call this Trinity Commons. The location is right downtown, right next to Kennedy Park, is within the zone of the HUD Choice Grant that increases, and we think that increases the importance of assuring the viability of the building and expanding its use in and for that neighborhood and the wider city. The renovations and additions that are planned will make that possible. The upstairs will remove the pews, refinish the floors. It'll add a meeting room with a kitchenette and bathrooms upstairs because there are none. So there'll be a men's and a women's multi-stall bathroom so that it can be used as a gathering space for the wider community. And it will it will have, digital projection for films and sound equipment and lighting and things like that. I invite you to come and see the space. It's a beautiful architecture from the 1880s. And we even have stories of Marsden Hartley as a choir boy there in his young days. We don't want to let it close, and we think that historically it's important. It will bring, I think it will help the economic development of that neighborhood. We're really thinking that a place to gather together across cultures is really important. We've been told that a lot of the Somali and other African weddings happen at hotels and they can't have their own food there because of codes. And they pay thousands of dollars for weddings and don't have the food they want. So we'd like to test out that idea. Would it be a venue if it was not as explicitly a Christian church? So that's the hope. I invite you to come and see it and learn more. I have said to various groups in town that I will be there in the building on December 6th in the afternoon from 2 to 5. I will also be there Saturday morning, the 11th, from 9 to noon. And you're welcome to stop by and see it, look at the floor plans that Platts has made, the initial floor plans. Some renderings, some computer-generated renderings, and I'd be happy to answer questions now and later if you come visit. All right, thanks.
Questions for Irene or Clara? Yes.
Madam Chair, I get a bunch of questions here. Good. And they're addressed to both of you. I've been in the building, I've been in the facility both upstairs and downstairs. It is really a nice building, and it would be a shame to see it go. How many volunteers on average do you have on a weekly or monthly or yearly basis?
We estimate about 250 a year.
250 a year, okay.
The minimum is we have 2 volunteers a day. One does Hannaford pickup, one does Bates pickup. We have 1 person prepping food. There's at least 3 on site every day. It's usually more like 5 or 6.
Okay. And staff, now you're the director, and I know you pull your hair out once in a while, but who else do you rely on that is not volunteer?
Our entire team is 5 full-time positions, 4 full-time staff, and then the last 3 split 1 full-time position.
Okay.
That covers us 6 days a week.
And do you have hours of operation?
Yeah, we're open 7:30 to 3, Monday through Saturday.
Okay, and do you find the same people returning day after day, week after week, or are you, I guess, you must have a core number of people that are dependent on you, or is there a turnover in who you help, or how does that work? Do you have statistics on that?
Off the top of my head. With the elderly folks we serve, it's not a lot of turnover. It's folks on a fixed income. They're in their 80s. They're not going to go back to work anytime
They
soon.
depend on you.
With the other programs, the shelter it's a lot for a very short amount of time, and then they're gone. Usually, as soon as they get into housing, they'll come for a little bit to like get groceries and stuff, but then we usually don't see them again. And then the resource center and the refugee program, it's similar. It's kind of cyclical. Like people will come in and say, I don't have a job, I will do anything. And we'll help them get kind of a starter job, and they'll come back a year or 2 later and be like, you know, this is great. I'm tired of driving to Brunswick, driving to Wyndham. You know, my buddy works down at Aramark at Country Kitchen. They have some openings. Could you help me? And then it's like getting people through those steps. COVID was a big setback. We saw a lot of people that we hadn't seen in 2 or 3 years that had just lost their jobs. We had a lot of people doing like hotel housekeeping, a lot of people working as ed techs, just knocking on the door and saying, can you pull up that old resume and help me update it? So we're there. We don't have, like, you don't have to be eligible for our services. Anyone can just knock on the door and ask. So we're not going to say, like, I'm sorry, we can't serve you anymore. You've got a job. We're always going to be there if something comes up.
So this funding you're seeking, is there a different budget for the upstairs and different budget for the downstairs, or are you looking at it as one big glob?
I mean, right now, we're 2 separate organizations, but as soon as the building is transferred, then it becomes managed by the Jubilee Center. The programming upstairs may happen by a community collaborative or something like that. But they would be the legal
They would be the,
and financial responsible party.
okay, because they own the building.
That's correct.
But you don't want to be involved in the operation of upstairs there, and
I already don't sleep very much. Trinity is enough. I think we would end up having like a per diem person manage it.
Right. We've talked about hiring a manager for the upstairs space
yeah, you do.
that hopefully is paid by the income that comes in from the rental.
Yeah, if it's well managed, there's a need for that, definitely. I noticed that your budget page has no figures on it in here.
It's a draft.
It's a draft, we're just starting the capital campaign, and that's a draft. You're the first
Very-
ones to
very
see the
creative.
draft case statement.
Very creative budget.
Well, at what point are you gonna put a number on what you're asking the county for?
We could do it, I mean, I could tell you the cost of the whole building, the renovations cover 1.5 million. 1.6 million are the renovations,
Okay.
the estimated by square foot.
And so you're still looking at various sources of funds?
We're just starting capital campaign and talking, and we've had several foundations come and look and talk to us about it
Okay.
also.
Because I think we'll be addressing the requests in April, so you've got to get back to us.
Certainly, we could do that.
Okay. That's it, Madam
Thank
Chair.
you, good questions. Other questions? Go right ahead.
Not so much a question, but I work in the field of mental health, and I can't begin to tell you the number of clients that I have accompanied to the Jubilee Center to obtain the one, hot meal that they, could depend on for the day. A box of food, nutritious food, fruits and vegetables that, would carry them through, the week. Thank you for the work that you do, and, I look forward to, looking into your need and, what we can do to help.
Thank you. I should also mention Chris Abruzzi is here. He's one of our board members, so you're welcome to lob questions at him too.
They're trying to deflect.
So he doesn't have a gag order or anything?
I'm glad to be here. Sorry I'm late. I'm actually meeting some of my colleagues who have been on this project for about 2 years, but we've been doing it all via Zoom.
All
So
through.
it's nice to see humans. Yeah, I'm here just in support. And, yeah, I think we're 100% behind it. And, we have to succeed with this project because if no one fills the gap and fills the cracks that we do, so we need to expand, we need to sort of facilitate the receiving and distribution, and we can't do it in the current space. It's just, it's not, it's tough on the staff, and so we'll make it sustainable. We think we have the funding base to do that, and I call it an easeability study, not a feasibility study, so because, like I said, we have to succeed, and we're gonna hopefully get the funds we need or right-size the project so we can expand, so that we don't burden staff with the gymnastics they have to go through to receive and distribute at scale is tough. And we're adding staff and happy to do that, but we do want to take some of that, we want to ease that process of facilitation.
I've seen your operations set up literally on the sidewalk where you're handing out, bags and boxes to people.
Like, even outside all last winter in COVID, it never stopped. And the other thing that I meant to say and didn't write down was that the partners the church has been talking to for use of the upstairs are everywhere from the arts, LA Arts, LA Arts, Maine Inside Out, some of the immigrant groups, Community Concepts is very interested in this happening and is even willing to help us with things like historic tax credits if we need it. I think there are some church groups that have expressed an interest who are small and don't have their own space. I think Maine People's Alliance is another one, and Healthy Neighborhoods, they're now meeting in the chamber boardroom. So they all of them need meeting space, gathering space, organizing space, and we just, with Bates College help, will put together a plan of how to make that happen.
Is there a timetable for that? That's Bates College?
It starts in January term,
Okay, but you don't...
and they'll be finished in April. Right. So we'll try to do it before your deadline.
Yeah, you gotta keep track of our timeline.
It would be what's it called? A capstone project, a group of 3 or 4 students, and they would, it's just a small period of time.
Any other questions? Commissioner Mike?
Thank you, Madam Chair. Irene and Clara, is it Claire?
Clara,
Clara.
with a K.
I mean, thank you for coming by. Actually, I didn't realize the Trinity Study was even going on. So I'm pleased to know about it. I'm versed, not versed, but I'm fairly knowledgeable about the Preble Center in Portland. So I'm pleased that this is something that's going on here in town. And I'm interested in finding a way that we can support you in some way that's appropriate. I have an image embedded into my memory from when I was 5, 6 years old. This is the church on Main Street up near the hospital?
No,
Oh,
this is right next to Kennedy Park, the
Okay, yeah,
corner,
I know which one.
corner
I
of Base
don't-
and
I
Spruce.
don't have a memory of it.
Is there anything you wanted to contribute?
I don't think so. I mean, I think where we are so far with the budget is pretty well on. That budget was built probably 4 months ago. As you all know, construction costs just keep going up. So by the time they get to build this, it may be higher than that. You just support it. Everything they do is really amazing.
The building's in fairly good
The
shape.
building is in pretty good shape. A little bit of roof work. A lot, the systems of the building are antiquated. The plumbing, the heating, there's no circulation at all. So we'll bring that all up to codes. And I think the circulation piece particularly falls within a lot of this money that we're getting for COVID and for improving spaces that people gather in. So that would certainly would help. And in the new space and bathrooms, there's basically no bathrooms there that meet any kind. So we're putting those on the first and second floor. I don't know if you have any questions about construction or anything. Feel free to ask.
Go right ahead.
I think I'm familiar with the church, but then maybe I'm not. Land-wise, I hear you want to expand, and I have to admit, I think a postage stamp lot is what you're working
Really
on.
tight. Expansion's gonna go right to the setback. If you're facing the church on the
Can I
right-
show you in here?
Yeah,
Yeah, there's an
yeah,
area
that's a
where
picture
I
of it.
saw, but
This is the back on the Spruce Street side, so there will be an addition here. So it's that backyard between the church and the apartment building. And there will be 2 levels from above here back.
Okay,
So it'll fill the lot, we'll go right to the setback line.
okay, yeah. No parking.
We don't have parking now.
You don't have parking now.
There's
But
a
this
lot
is-
on the street.
I mean, my understanding of the Jubilee Center, the whole thing is you are where the people are that need the help.
Right.
Versus like, food kitchen pantries that's here in Auburn where yeah, you're in the neighborhoods, because these people don't have transportation, and I understand fully well what you're doing.
We have a lot of kids that will walk over and get food. On days when there's no school, they'll come and get lunch for themselves and their siblings. Oh, God. We do the summer food service program every year. It's like the community-based version of summer food, or free and reduced lunch. And because of COVID, they gave us these waivers to do grocery boxes instead of served hot meals twice a day. So we went from having like 5 or 10 kids at breakfast, 5 or 10 kids at lunch, to serving, I think by the end of the summer, we were up to 700 children a week. It's just so much more accessible. Mom doesn't have to like bring them all for breakfast, bring them all back at lunch. You just come once a week and you get a box for each of your kids, and it's like milk and mac and cheese and chicken nuggets and all of that stuff. It was just so much better. Like, people, they're not home with their kids all day. They can come on their day off and pick it up. Anyway, it made our lives insane. We had food stacked all the way to the ceiling. The shelter was down to 5 seats. It was just, we bring everything in and out of the building on carts, and it has to go through 2 doors that each have a sill. And the carts get really heavy, so the only way to get them in and out is to get some momentum going. But if the cart shifts, you're gonna hit the door jamb, and then it just like knocks the wind right out of you. It was a very long summer, but we fed, God, I don't even know, 70,000 meals. It was crazy, but it was just another example of like, when there's an opportunity, we have no flexibility to meet it. And I don't think I mentioned, we're still serving completely outdoors, all the lunches, all of the food pantry because there's just no space. We had to make the shelter a priority, which means all of our food storage is still in part of the shelter, but it's stacked as high as it can possibly go. And there's nowhere to bring in 100 people a day to try to get food. There's just no space for them. So we are outdoors until something gets built.
And hopefully we have the new addition before another winter goes around.
Yeah, it's a long winter, and it's hard. A lot of the folks coming are kids, they're elderly, they want to be able to warm up before they head back home with their food, and there's just nowhere to put them. There's nowhere to bring people in the building.
Yes,
It's my last question.
No, you're fine.
Did you ever discuss or think about separating the food function from the personal help function? In other words, I'm thinking of the old school across from Tree Street, on Birch. Full kitchen in there, plenty of room for dining tables and what have you. Have you explored separating functions in different locations?
Yeah, we actually were talking to the city about that at the beginning of COVID. They wanted to give us the Longley Gym as an overflow shelter, and it ended up not working out. But part of our issue is that we have such a small staff. We run 6 days a week. Some days there's only 2 or 3 staff on. And in the current setup, we can have 1 staff in the kitchen, 1 in the office, the shelter's in the middle. We can run the entire operation with 2 staff. If we expand it into the upstairs, you need 2 staff on if you're gonna have clients in the building for safety reasons. Once you start separating, you need to just hire more people, and that's a huge cost that we can't afford.
I volunteer at the nutrition center, which is in that school building. They also are overwhelmed and needing space. So they don't have room for anything much else. I was packing 300 bags every Wednesday, and they get distributed to people on Tuesdays, and then there's a food pantry there Tuesdays and Fridays, which is another whole slew of people. So I can't imagine they would have room or capacity. But we certainly partner with them a lot. For example, the church, the Center for Wisdom's Women, the Jubilee Center, and the Nutrition Center raised funds through the Episcopal Diocese and local churches to help put our clients who were on the street in hotels if it was sub-zero. Because we just didn't want to have somebody that we cared about be dead in the morning. So it's not an open public thing it's not available publicly, but for those we know and work with and can trust, we do that together. So there is partnership happening. Yeah.
Okay, anyone else? Thank you so much. You
Welcome.
do
Thank you.
wonderful work. It's been
Thank you, guys.
a joy to hear about it. Thank you. Hope to see you at the church.
Thank you so much.
Okay. Okay, and the second presentation this evening is from Tri-County. I think you have the handout for Tri-County in your packet.
Good. Thank you for inviting me here tonight. I am Jamie Owens. I'm the Chief Development Officer at Tri-County Mental Health Services. I know you have my presentation. I also want to introduce my colleague, Julie Olam. She's our Chief Financial Officer. Should you have any questions about finances, she is our expert, and she gets us through every day. I have some prepared remarks, which I'm going to read because I haven't memorized them, and then we'll go through my presentation. So I've worked in behavioral health, which is mental health and substance use services, since 1992. And I choose to work for a Maine nonprofit, which I've done since 1999, because I really have a passion for securing funding to support the work that we do to save lives. I'm here tonight because the American Rescue Plan Act funding to the state, counties, and municipalities recognizes that allocations can be used to provide assistance to households, small businesses, and nonprofits. Governments can utilize the funds to hire nonprofits to provide services that respond to the negative impacts of the pandemic, and a use can be for services to address the disparate impact of COVID-19 on certain populations and geographies. So I'm going to explain really what that means to Tri-County Mental Health Services. So COVID-19 has created a public health crisis not seen in more than 100 years. Not only is the virus a killer, it is exacerbating an unavoidable and tragic public health crisis. Suicides and substance misuse, overdose and death due to opioid addiction. Rates of depression and anxiety are up 40%, and youth suicides are up 40% as well. Rates of substance misuse are up 45%, and 504 people died from overdoses in 2020, outpacing accidental deaths. This year, 2021, is on track to record more than 600 deaths compared to the very real potential for 9,000 total overdoses by the end of the year. Illness encompasses physical and emotional dimensions. Emotional trauma causes actions and reactions that create diseases that are highly treatable. Mental health and substance use illness are diseases that have a good recovery rate. But like many health disease conditions such as diabetes, cancer, heart disease, recurrence is possible. Continued treatment and social support using current or new best practice methods are used when this occurs to give its sufferers help and hope to recover again. At Tri-County, we employ more than a dozen evidence-based practices to the services we provide. So in closing my remarks, it's really vital to remember always that treatment works and recovery is possible. Just as we would not give hope or fail to help somebody with diabetes, cancer, or heart disease, the same is true for those who live with mental illness or substance use disorder. We can and must bring all resources available to bear and create them when they are not to help those in need, because every life is worth saving. Now, I know that the folks from Trinity Jubilee Center have left, but I really want to acknowledge the work that they do. They're in the business of saving lives as well, and we work with them every day in the work that we do. We are truly peers in service. So now I'll move on to the presentation. So who is Tri-County? Well, we've been open since 1951, always been a nonprofit organization. Actually, we're started, if you're not familiar, as a secular organization with funding from the diocese, but that was transferred over in the 60s when federal funding for community mental health centers. First, Tri-County was designated as a community mental health center in Maine under the CMHC Act of 1963, and we were the second nationally to be funded. And there were thousands of community mental health centers funded out of this law. Currently, we have 209 staff. Before COVID, we had more than 300. We provide mental health, substance misuse, and intellectual disability services right here in Androscoggin County from our locations. We served 900 clients just in the past year. And in total, we provide services in Androscoggin, Cumberland, Franklin, and Oxford counties where we have services kind of proper as far as locations. We serve 2,500. We also have a partnership with Central Maine Health Center where we have social workers embedded in their practices, seeing families and children and adults. We're state licensed, and we're also nationally accredited by the Council on Accreditation. Accreditation is not a given for us. It's a lengthy, intensive process whereby the national organization comes in, and we just went through it in October, and they come and they look at every aspect of our operations and spend days with us, and we have passed. In fact, with flying colors, and this is our third consecutive 4-year accreditation, third or fourth. Our offices are 1155 Lisbon Street, and we also have group home supportive residential services for individuals with severe and persistent mental illness here in Lewiston and in Sebatis. So what has COVID done to us between 2019 and 2021? Well, we've seen a 31% drop in individuals seeking service. That's not because people weren't in need of service. It's because of the impact that COVID has had on our community. We've seen an increase in our uninsured and underinsured clients is up 100%. Our wait list has tripled. Prior to COVID, somebody could come in for service and we might have to kind of look around and juggle some things around, but we could definitely get them right in. Today we have more than 800. In fact, we got every day, every week, we get a report and the wait list increases. So I'm sorry, it's 330. The 800 is total, more than 800 across all of our sites because there's just not enough services to meet the need. Our revenue just here in Lewiston decreased by 28%. Our reimbursement is stagnant from all payer sources, private insurance, Medicare, federal, state, private grants. We haven't received any rate increases at all to meet our needs. We are a nonprofit, but we're a private nonprofit, and we need to make a surplus, just like any business, to continue operating. But we're also a safety net provider. We don't turn people away. They come to us. We do everything that we can to identify what type of resources they have to pay. But if they don't, we try to figure out how do we do it, whether it be by grants or getting some monies maybe from some towns, the United Way. And in the past year, in 2020 especially, foundations in the United Way were especially really willing to give money to help us just operate and keep the doors open, which is really what we needed, versus having extensive performance indicators and measures. And we just needed money to keep the doors open so that we could see people. We've received some provider relief funds. We did receive a PPP loan. If you're familiar with PPP loans, that allowed us to pay wages and benefits, but we also have other expenses over and on top of that to keep the doors open. And we've just had a real inability to cover the increased gap between revenue and expense. One of our board members is here, which I believe you're familiar with. Eric Sampson is on our board. And so he knows firsthand and has been on our board for a long time what we do, how we do it, and what our needs are. So all that being said, what happened when COVID hit? Well, we immediately, I believe it was March 13th, we shifted from completely face-to-face. We didn't do any telehealth at all, and we transitioned literally within 2 days to doing all telehealth. But we also had to close down our social learning center in Lewiston, which is and has been there for many, many years for individuals with intellectual disabilities. It's a day program, and many of those folks were then quarantined because they couldn't come in. Many of them have an inability with masking, and we literally had to shut that service down completely for 3 months. And only when we reopened it, it took another 3 to 6 months to really start to get clients back, but it hasn't really recovered. Even today, every day there's a different story, and it's, what's the new strain and what's the new call for masking and, work from home. Our staff have been expected to be back in the office working. since last December, but we still have some staff, especially those that meet with clients in the community frequently, working from home because it's more convenient for them. Been challenged by, of course, families with children out of school. So we've been sub-optimized somewhat in serving the needs as it relates to that as well. And it's incredibly difficult. It was difficult before COVID with certain positions to recruit. It's been kind of moving that way in the past few years. But with COVID, we just don't have enough staff, and we can't recruit enough staff to work to meet the needs. Right now, we have 34 positions alone in Lewiston out of about 60 total in our organization, out of 209 total full-time staff. So we're essentially, I mean, we all know what we're kind of all wondering. I mean, we're kind of wondering, like, well, where did the workforce go? Well, it's even more difficult with mental health because we just don't have people coming in, and people, because of our rates and the way we're paid, and folks are looking at, maybe they're making $15 an hour, they can go work at Walmart for 19 or 20, or they can go actually to TAM Brands and make $23.61 an hour, which is what I heard on the radio the other day, with no experience. And these are individuals with bachelor's degrees, most of them. Have a very hard time keeping staff at our residential services. I've seen the stories in the paper about individuals with intellectual disabilities and how they're placed in homes and they have attendants. These are the same staff with these credentials. We're all trying to recruit the same type of staff. So we have openings for counselors, nurses, care coordinators, peer specialists, all of which require specialty training and credentialing, as well as administrative office staff. So that's what COVID has done to us. So I'm here this evening to advocate for the county to allocate $100,000 of the town's ARPA funds each year for the next 2 years to help us to hire an intern clinical supervisor, which will help us to increase access to care and reduce the wait list for services. This is not something that's done across the state. We've been having conversations even with the leadership at the Office of Behavioral Health and DHHS about this concept. There's no rate to really pay for this because this type of position wouldn't be a billable service, because this is a supervisor who would be using their skills, considerable experience, to supervise master's level interns and bachelor's level clinical interns from Maine's universities. We already have interns and always have. We're a training ground, which community mental health has always been a training ground for the nation's universities. And these services, we don't pay for them and they don't get paid. But our vision is to have somebody so that we can recruit more interns and somebody who can work with them exclusively. Right now, we have a couple interns assigned to Mary and some to Susan and over here, and it's kind of a helter-skelter approach, and it's, it works, but then it makes it hard to then bring the same level, the same person, the continuity to do that. It would be a 40-hour position. It would be licensed clinical social worker. These individuals have a master's degree from accredited universities, and then after that, they have to actually have more than 2,000 hours, of which is supervised for them to become independently licensed. And this is to help us work through our workforce capacity and help to bring people off that wait list. This dollar amount of funding covers wages, benefit, and overhead expenses. And in turn, the investment would enable, say, 10 interns to provide services to 175 people, 8 sessions each, which is kind of on average, if you're doing brief solution-focused therapy. Excuse me. And we envision that this will be sustainable post-grant funding because we intend to offer this services with federal funding from the Substance Abuse and Mental Health Services Administration in 2023. We won't have this funding. It's not available to us yet, but we're looking to secure that. So I'm done with my presentation, and I'm be very pleased to answer questions you have, or if you have questions for Julie about the numbers, or is there anything that we can do to bring information back to you?
Couple of questions. So you used to have over 300 staff, now you're down to 209. Do you have volunteers, or does this qualify for volunteer work, whatever you do?
Well, the interns essentially are volunteers because they need to get their clinical. This is their clinical placement, so.
What percentage of the 209, or what percentage of everybody that works for you is?
Our staff.
Okay, but who are the how many interns do you go through every year or every 5 years?
Every year, probably 8 to 10, would you say, Julie, or more? Maybe 12, maybe more?
I was gonna say between 15 and 20.
15 and 20, see?
Okay.
Glad she's here.
All right. And, okay. Do you, now, what happens in the year 2024? Will you have enough funding to sustain that position?
That's our goal, yes.
Okay, so you're asking for 2 years. And my last question is kind of a loaded question. Do you have relationships with, like St. Mary's for the services they provide, or for Common Ties Mental Health Coalition, or?
So we have peer relationships with them. We take referrals, we provide referrals, we work with them as peer providers. So we are.
Duplicating, how much duplication is going on in mental health and?
I would say none, virtually. There's not a, I mean, we at Tri-County have a wait list of 833 as of today. Every mental health provider, we're a member of the Maine, of an alliance of all, virtually the majority of behavioral health providers, large providers largely. I think Common Ties is part of it as well. And that we're all in the same position. We have long waiting lists. The difficulty with recruitment is extensive. Right now, we're part of a federal HRSA grant, Health Resources Services Administration, that medical care development has gotten for the state of Maine to improve workforce development, specifically to bring people into the field to provide substance use services. So we work collaboratively. We see the same clients. We go to St. Mary's with clients, or St. Mary's sends clients to us, but individuals in need of mental health services can go anywhere to seek services. But the problem is that they're on wait lists. They'll go on wait more than one. I mean, we have 833. These people are probably on other wait lists as well. But this is the reality.
Now, you mentioned 500 plus suicides. For what area are you talking about? Is it Tri-County? Is it Maine? Is it New England?
People died from overdoses. That's in Maine.
Just in Maine?
Just in Maine.
Okay. All right, thank you.
Commissioner Michael?
Thank you. The number of increased deaths from overdoses and suicides. Do you have a total number for that in Maine? Post.
Well,
during
you see,
COVID?
the issues, we know it's up, but the numbers are, we know it's happening. I mean, we experience it weekly. As far as the numbers in Maine, they haven't been published yet because there's a lag in the actual epidemiological data.
And in general, is your ambition with people that come in, I know you have a waiting list of people wanting to come in, is your ambition to help and then release kind of thing, more than, say, the people that we talked to just before you got here, who were just kind of catching people that are 85 years old? Irene said probably not, these people are not going to go back to work. Are we trying to, I don't know, for lack of a better word, do some assistance and rehab and get people back on their feet? Or what's the end result in general with you folks?
The goal of treatment is to work with the individual. The individual, when you work with them, you do an assessment, you identify what their needs are for treatment, and then you work with them collaboratively, the clients in the center, and they identify what their treatment goals are and how to achieve them. We quite frankly see the individuals who are most sick and in need, because private practitioners can pick and choose, and they don't necessarily, much at all, choose main care clients or those with uninsurance, because they're very difficult. They're more ill. We work with the homeless a lot. We have a contract with the city of Lewiston, the police department. It's Project Support You, where we have clinicians riding along. We have 2 individuals who ride along with the police and help divert people and help them come to us. Hopefully, we have a wait list. When somebody walks in, we try to figure out, we're doing the care coordination. We're trying to figure out how can we help them to stabilize until we can get them treatment.
So kind of along the lines of what Commissioner Plord asked the previous people, are you seeing the same people year after year?
Oh,
Or is
sure.
there some turnover?
Sure. The
There's
numbers I
turnover
just
as well?
gave you, though, are unduplicated.
Okay, good.
So, I mean, duplicated count across services, and individuals may get more than one service with us. They may be in counseling with us, they may be getting care coordination. They may have, as well as getting services within the community. Getting services from Trinity Jubilee, going to the hospital to get their primary care when they shouldn't. We hope to divert them to us, so.
Good, thank you.
Did you have a question?
No, I don't have a question. I just want to commend you for all you do. You've taken on tasks that I really admire the
Thank
work
you.
that both you take on, because I know it takes a long time.
Yeah.
Mental health is not the same as breaking a leg and resetting it.
No,
It's
but
much
even
more-
when you break a leg, you need our services too.
Yeah.
I want to acknowledge that as well. I worked as a daily living skills professional for many years as a MERT 1.
Yeah,
So I'm very familiar with what you do. Thank you very much for that.
thank you.
And
The only thing I wanted to add is you brought up other agencies into the conversation, and they all have different clients. From my experience, there's some nonprofits like Tri-County, and then some of the agencies you mentioned are for-profit. And I'll let you know when you talk about seeing the same people or the services, while they may be similar, they have different clients. We fax every day our head count from the jail to area mental health providers. And there's a difference, and I'm not saying there's a bad difference, but some are looking for their clients to identify their clients and provide the services, whether they're a nonprofit like Tri-County who has a client list, an active one, or a for-profit like some of the other agencies in the area that are looking to identify or locate their clients as well. So services may be similar, although I think, like I said to you guys a couple weeks ago, Tri-County offers a
smorgasbord, for lack of a better, compared to some of the target services that other agencies offer. In some of the programs you mentioned, like with Lewis and P, we're running the same program, as well as I think I think the only agency that isn't right now is Auburn PD, as far as making use of Dave and those services. So, like I had said a couple weeks ago, when you look at Tri-County, there's no better place to get funding from than the county, because they literally provide services all throughout Androscoggin County and beyond. But I just, that's all.
So we're the governor's options provider, options for me, if you see in the ads, where they show people, there's 3 or 4 ads where they show families and or individuals in recovery to increase awareness about the need for treatment, and options was spearheaded by Governor Mills almost 2 years ago, and we were the first county. We were actually doing it beforehand in the ride-along, and now we do that countywide, and that's about connecting with the police forces and all the communities that are interested in working with us to do that. So we do it in Lewiston and Auburn and Lisbon and I don't know which other ones, so that's what we're doing, so.
Thank you so much.
Yes, well, thank you sincerely.
Yeah, thank you for coming in. We appreciate your presentation. Thanks very much.
We've got, did we have an MCCA meeting this past?
What?
No, an MCCA meeting in the last
Oh.
2 weeks, I don't believe, was there?
No. There is something that we got an email about today, which ironically, I see we have something here in our packet, though.
Oh,
About our our insurances,
thing that we're dealing with, I'm dealing with it, so.
but no, I don't have it.
In Workforce Board?
There was a meeting this morning, actually, and there are some exciting, training programs being offered in our, region, including culinary training, safe serve, patient services representative, and an accounting financial service representative training. It's nice, and those are all offered in Lewiston at the Mollison Center. It was very nice to know that our, taxpayers and constituents can take advantage of these if need be. That's all I have.
Okay, administrators report?
Just very quickly, we're wrapping up the 2022 budget, getting things into the system and so on, so that we can, for those of you new, we send a packet out to each of the towns. That won't come until February because we have to wait for the final state valuation. So we're starting to get those prepared. I will announce that in reviewing the motion last meeting to include Commissioner Larry's comments after the vote to adjourn on October 20th, the camera had been shut off immediately after the vote, and thus the comments are not in the minutes because they are not available. We're moving forward with software in the Treasurer's Office. The HVAC project is beginning. Roofing projects and probate starting to move forward. I have in your packets is just a draft opera action plan for selection of project funding. Sally has also done one, and we'll look at that and try to combine the two and bring that back for the next meeting. Preparing for the December 15th Commissioners meeting, where you'll see, we'll have discussions on wage adjustments for law enforcement for next year. We need to have preparation for union negotiations, which means we need to have a couple of commissioners to add to that committee. They would like to get started the middle of January, even though the union contract does not expire until the end of 2022. but we're ahead of the game instead of, when I got here, the union contract had expired 3 years before. So I look at some progress in that vein. That's essentially what I have for tonight.
Okay. Any questions for the administrator? Go right ahead.
What is a December, you said December 15 Commissioners meeting? What is that? Oh, that's our meeting.
That's your meeting,
Oh,
yes.
so it's not another meeting? No. All right.
It's our next meeting.
Yeah.
Okay, all right.
Get your geared up for
Oh, yeah.
things coming at
So we
you.
don't get lonely, yep.
Yep.
Okay, we're going to ask for any comments from the public, and Dave, I'll sort of depend on you to.
There's only a couple people, and there's nobody asking.
Okay, thank you. Okay, now we'll pick up where we moved the two presentations to other ARPA issues. I just want to bring something up, and then it'll be up to the commissioners what they want to do with it, because I don't make, as chair, I don't make motions. It's sort of a self-governance thing I have. But when we took the vote last week on the HVAC system, I think there's several of us that had some reservations about the price, that there was some things that just didn't seem right. Since that vote, I've heard from people in the business, and my reservations have actually increased. And in order to open that up and have additional discussion about that, someone that was on the affirmative vote would have to make a motion to open that discussion back up. And so I guess that's where I'm at, is if there's anyone that is interested in. And I'm not, to be honest with you, I'm not really looking to rescind authorization, but maybe just put some process or governors in it or something. There's been people in the industry that have raised additional red flags about the price tag.
Madam Chair,
I think Commissioner Poirier had his hand up first.
I think I'm the original person that made the motion for us to go ahead with this. And I really think I would love to have it reopened. And just for clarification, I think there's so many parts to this. I think us having a deeper discussion is ideal, in my opinion.
Would you like to second that?
I second that motion.
Okay, thank you. I didn't know if we ought to discuss maybe putting some extra safeguards in there to where before any expenditures are made, rather than afterwards, that we have a chance to look at it. It seems like that price tag just doesn't ring true. I mean, you know, to be honest, I have family members in the business that do commercial. Now, it's completely different. They do the Hannafords in the state, and I know that's not this building, and it's a whole different, they do wide open spaces. But even the engineers they used have said, you know, to keep an eye on those numbers. They felt like that number was a little high. And one of the town chairs contacted me and felt like we needed not to, that we should, he was the first one to suggest that we pull back just the blanket approval, and instead sort of go forward and just take this in increments where we can actually look at the expenditures before they are spent. Yes.
I'd like all proposed expenditures to come to the board and go through Clarice to make sure they're in ARPA lines. I don't want this to bite us a few years down the road.
Madam Chair.
Yes. I'll get back to you in just
Are
a
you still
second.
in the middle of it?
No, go ahead.
You might want to be careful when you say all expenses. You don't want to have pencils, the
Fair
fact
enough,
pencils
yeah.
income. So
Yeah.
we got the idea, and something reasonable and works in terms of us reviewing expenses, of what you're proposing, I guess.
I would like to look a little closer. I'm not real clear, and I could probably get the answer, Dave probably has the answer to this tonight, about, there's the upstairs, and we've been given notice that they're moving out, the Historical Society. Then there's the downstairs, which,
Don't know, but they know they want to go. I guess is the way I understand it.
There's a
But
period of time.
This takes care of the whole, does all of the HVAC, it does all of the downstairs renovations that was originally thought of.
I don't know that we want to go forward with downstairs renovations. That, I guess that's,
Well, picture it as, regardless of who's down there, it's horrible working environment. Whether we use it for storage, whether we use it for overflow of staff, it should be updated. We could take other departments, that we donate, well, not donate, we give money to other outside agencies. So instead of giving them maybe instead of giving them money, we could give them a place to house. We could give them internet, we could give them telephones, the stuff that is already embedded in what we already pay for. If we give them a place to sit their roots down. That'd be one idea for the basement. We have other DAs that don't have a place to sit. We could put the DA's office, a couple, like a satellite office. There's other ideas of what we could use the space for, if it was updated and cleaned.
I'm not interested in putting anybody down there. I think it's a suitable storage area, which means we would have to have some good dehumidifiers down there so records don't get destroyed, but I don't know that that's a suitable work area for people. No, I don't think so. I think I've seen it with my eyes.
Okay, but I do tests every couple of years. I get a KDA contractors to come in every couple of years. We do mold, we do air samples, we do all of that stuff. Every year we come back just fine. So I don't always believe that. I get professionals in and I get things tested. There is no mold. We had an episode. The gutter was leaking into the building. We fixed the issue. We had the mold abated. We fixed the room. There is no mold. I have test results to prove all of that. It's a good not livable, it's a good working environment if it was updated. The ceiling heights are gonna be fixed. It's gonna be normal commercial height. The floor is gonna be leveled, flat, brand new flooring, new ventilation, outside air coming in, air conditioning, heat. It's gonna be normal office environment. Whether in the basement or the first floor, it's gonna be the same.
How many square feet are we talking about, the basement?
Of that repair.
Because the whole thing,
4,000 square feet,
4,000?
maybe. Like the hallway downstairs is, I'm not including the hallway, but the hallway is gonna be updated. So instead of the hallway being a slope, it's gonna be leveled across.
Okay,
It's gonna be drop ceilings to cover up all the piping.
yeah.
It's gonna look like a normal hallway, a normal office space.
I guess I'm listening to this and is that HVAC? When we start to renovate the building, that's not HVAC per se. I mean, I understand air circulation is based on how rooms are designed and stuff. But if I'm listening, we're talking about resizing rooms
Nope.
with no set idea of who's going in there, or am I not hearing that?
Right.
What are we doing? We're gonna take the same office spaces that we have now?
It's on the preliminary drawing, so I
Okay,
have to explain the colors a little bit more, but, so the greens,
okay, go ahead.
so we actually paid a contractor to come in years ago, and they did a full assessment downstairs to rehab it. They had some preliminary sketches of what they could do with the space. So right now, if you go to the basement, it's like a maze. It's,
Upstairs it is too, but that's okay.
right, so they're gonna take that right out and make a straight hallway, clean that up. The green space is all gonna be leveled out. New flooring, so right now, if you walk into one room, you drop down 2 steps, and then the floor slopes a lot. If you put a chair on there, you will roll into the wall. We don't know why. We assume this probably for drainage back in the day, but all that's gonna be taken out, it's gonna be leveled out, all the same grade, all the way across the rooms. The bathrooms are gonna be brought up to code, to ADA, new ventilation, new everything.
Go ahead.
I'll just say, I'm not on board with the full basement remodel. I think we need to look into that a lot more, and we need a lot more conversation on it.
Well,
We
I'm
haven't
just
had the
confused because I
presentation. Okay,
made
go
a
ahead.
motion to put in a HVAC. And I have to admit, we had the gentleman, the engineer here, and he talked about engineering for the air handlers
Yeah.
and the
Right.
furnace.
I missed the
And-
basement.
and I guess-
Reno.
I didn't understand that he was also talking about physical construction, okay?
Neither did I.
So,
So this is what's throwing that number off.
Yes.
because how much of this is, because now I'm,
Well, see, the original, so the first quote we gave you guys was, what, $2 million, I believe?
Yes.
Which incorporated that project along with just the cooling and heating that section. And then you requested that I go out and get an additional price to add cooling and ventilation for the entire building. That added another $3 million. So that hence the 5-point-something million.
But if you remember, it was asked more than once, how did this number go from point A to point B? And we were told, well, things have gone up and it's the air conditioning, but it's not, it's this.
No, that was already spoken to you guys. The first packet we gave you, that's what it was. And then you asked what changed. What changed is we added the air conditioning. The initial quote has always been there.
Right, okay.
well, if it was,
But
I'll be
this
honest
really
about it.
helps when people are saying, there's something wrong with that HVAC number to me, because now I can say, well, it's not an HVAC number, that's a renovation number. So that information is
I have a
very
question
helpful.
For Clarice. Is a basement remodel, is that even fall in ARPA?
If it has to do with social distancing and air,
But what about space that we don't have anything set to use in?
Well, the problem we do, I mean, we have, the sheriff is still there, okay? So we can't say he's
When
not
this whole
there.
thing happens.
Well, that's what the engineer does. He'll plan all that, whether we get mobile offices in or whatever. That's the engineer will figure all that out.
Well, and we haven't had the sheriff put together the advisory board, and we haven't, I think very soon we're going to be hearing from that advisory board, but I think we already know, and we're told that the engineering report from that the advisory board had done says that there's not going to be enough square footage.
I'm not saying the sheriff's department needs to be there. I'm saying the basement needs to be updated and brought up to today's codes.
For storage?
I'm not saying storage, I'm saying office space. For people to inhabit, to use it every day for space, county courthouse is running out of space, we don't have it. People are starving for any real estate. It's been like that since the day I started here.
I don't share that sentiment on the basement. And like Roman was saying, I missed the full basement renovation from the engineer that was here. I thought we were talking strictly heating, cooling, HVAC.
Yeah.
Well, that was in all the literature that was given from the start.
It was?
It was.
Okay. I'll go back and look at my.
Can, well, what I would like to see is a little bit more of the detailed costs, not just $1 million there, $1 million there, $1 million there,
The
you know.
first report, you asked that, and you were all given.
Well, he wasn't here,
Sorry, you
just to,
weren't
just to
here.
give him the benefit.
So the commissioners were given a breakdown of costs for the initial quote I had given you guys, which is the basement remodel, the heating, the cooling, tearing down the boiler room, tearing down the chimney stack, including new boilers throughout the courthouse. There is a cost breakdown in what you guys were given.
What's the cost on the basement for all this? Do we know that?
No, because it's all, a lot of stuff's combined.
It would be nice to have, you know, a breakout or an alternate, you know, if the basement was treated as an alternate. The other side of the coin is if, when you're getting into HVAC stuff, if you don't do it all at one time, you'll never get it. You'll never get it. And it's gonna cost you twice as much to do another section of it, because, oh, well, our condensers are too small for this extra, all this stuff. And so I think, we always talk about best use of our facility, and then investing in making a good decision for investing for current use and for future use. So let's be careful about not throwing the water, or the baby out with the whatever, with the bath water. Too many bees in there. Yeah, so I'm not ready to go one way or the other, because I need to look at the numbers. I need a feasibility study for the basement.
Ed, have you taken a tour of the basement?
No.
I think that might be an important thing for you.
All right.
I mean, we've all taken one. And my memory of it is just a really dark, damp space with a low ceiling. I think that it would take a lot of renovation to make it, into a pleasant workspace for anyone. Can't imagine anyone, lining up and think, me, I want to work down there.
Yeah.
There are no real windows, no natural airflow, no natural light.
And
I don't remember that.
we do have a feasibility study.
I don't remember that.
Soon, you two that are on that advisory board, that's going to be coming. Do you think even next meeting that could come before the commissioners, is what the sheriff put together a board, or maybe I should ask you directly?
My plan was, like I had sent it to Larry and the commissioners, because I didn't know who had to give Clarice the go-ahead to inquire with the U.S. Treasury. The question becomes, is ARPA funding available for the purchase of a property? Personally, I think it qualifies for the same reason the study was. We have no public social distancing here. There's just numerous reasons why this facility doesn't work, and I think we've never had them here, so we don't realize. But regardless of how you fund it, I think we've proven that this place isn't suitable, that there's not enough space. The basement isn't an appropriate place to have offices, even if there was enough space. So it's time for us to locate to a permanent home that meets the needs of the agency and the public we serve. Regardless of how you fund it, like I've told Larry, whether it's ARPA funds, whether it's bonding, whether it's a lease purchase option with whoever's selling the property, or a developer that's willing to finance it, I brought to you a problem. I'm looking for a solution. The committee has found it with me. The funding mechanism, that's totally up to the commissioners. The authorization to pursue a place we find viable, that's again up to the commissioners. But we thought it might be advantageous to find out if ARPA funding is available. And later on, if the commissioners decide to use that, makes sense. The property that we have identified in comparison to the money you're spending on other things seems more and more reasonable every time we look at it. So if we could get some action on that ARPA question, that would be helpful with us. And then if not, like we were talking to the realtors yesterday, buying property or and things like that through municipal government, it's not an easy thing to do. And because of the time involved, it usually costs you more. If ARPA funding was available, I think there'd be huge savings for the county in the purchase of any property. That's just what my observation was yesterday.
Okay, did you have something you wanted to jump in here?
Two things. Clarice, I'd like to formally ask you to look into the ARPA funding for properties. Two, I'm gonna be stuck on this basement thing until I see an actual cost breakdown of the basement, not mixed in with everything else.
That's exactly what you're saying.
Mayor-elect Shalene and I will be touring with Eric, the building and the basement and the jail in a few days, whatever. So I will, what's the timing on this? When do we have to,
They've already started. When you guys agreed to it.
when they are, okay.
When you guys agreed to it last round, we got the ball rolling, because this is a 2 or 3 year project. We have to go to bid first. We do.
Okay.
But the engineers still have to do their part.
And, we'll look at that, and then we've also got the study that was done by the other engineers, and I think we need to just slow down a little bit and get all the facts together. It's a one lifetime opportunity, and we got to get it right.
I need to comment on that statement. So I've been here 20 years. We've never put money into that basement to fix it up. Whether the sheriff's department is there or not, it should be cleaned up and renovated. New walls, new paint, flooring, let's make the place safe. Make it so that we don't trip going down a step for no reason, that there is no step.
Well, we have an obligation to preserve our asset.
And in 10, 15 years from now, we may want to use that for other space.
You know,
If we don't take the opportunity now because we have the money now, we should invest in it, in the building.
So let's see what,
I mean, I've had an engineer and an architect both go down with me through there, and they've all said it's very viable to make that into quality workspace.
well, it's a lot of space, a lot of square footage, I mean.
So you just said something. We have an engineer, which of course, that's what I think of designing the HVAC part of this. But you also said just now, we have an architect
Yes.
involved? Okay, see, and I guess
I didn't know that.
that,
Well, just
that's
it.
my problem.
All these things you guys are doing with the sheriff, I've already done. He's doing a feasibility study, which is the space that he needs, and I agree that the space downstairs is not suitable for them. But what I'm saying is that I've already done, with your permission, to do this work. I started in 2017, 2018, where we had engineers, architects, they've come in and looked at the basement. We've done a lot of the analysis.
Right, but I think, I'll just tell you how I feel about that, Dave. I knew that had been done, and I thought it was a $4.5 million bond issue that we were talking about at one time. What I didn't understand when I made the motion is that I was still going back to that renovation plan. I thought we were just, I mean, like, I think the last meeting, matter of fact, I went back and asked if we were putting HVAC on the third floor in the Historical Society section of it, because I didn't know that. And then I also asked about the fact that we were putting HVAC in Lewiston at the central station. So I've been asking questions, so if we didn't ask the right questions, just gonna say we weren't, I mean, it's, maybe we didn't ask the right questions, but sometimes you weren't forthcoming as much as I would like to have seen you be in this, and that's my concern, because again, this is more than HVAC, and it would be good to understand. I understand what Ed is saying, and what you're trying to say is, you know, we own this building, and is there a use for that space? But we're not gonna, if we're not creating rental income, or we're not creating, I don't know, we create all the space, which will be nice, but who's gonna be using it? You said something about trading
Well,
with
this is just an
companies?
idea.
But who's that we trade with? I didn't even know that either.
No, we give, what is it? Linden Soil or Parkin Soil, whoever they are, we give them X amount of money every year. You know, I'm just saying, we could give them other services instead of giving them money. We could give them a real estate to house, instead of them paying rent and lease programs and telephone and all that stuff. We could easily give them that at almost no cost.
What about emergency management? That's a little touchy, isn't it? I mean, Lewiston owns the building, they wanted to be putting money into that.
Well, that
They
would be,
just put a lot of money into their space over there.
Yeah, but all that was mostly grants.
yeah,
She got.
and there's a lot
Well,
Yeah, but we shouldn't have put it.
It's all been grants, because it never came before the commissioners. And when I asked about it, I was told, you don't have any business with that, and I don't know that I agree with this, because this is all coming from grants, so that's why the commissioners have no say in it. And then last meeting, we get our budget, and we find upwards to $9,000 that we're paying because of overages on that project that we didn't get to have a say in. So I'm not getting on board with that with you, you know, that shouldn't have happened. That we should not be paying in overages on a project that we were told, you can't have any part of that because that's not government money. I don't agree with that. I don't, but I may not know enough information to agree with it. I don't know how independent EMA works. I've looked into it extensively with the jail and the sheriff to make sure I was right, and they do, you know, the statute clearly gives those decisions to the antiquated term, the jail keeper, or the, what? Yeah. But, you know, so we only have the budget. So if EMA runs on that same type statute, I'll be honest, I haven't looked into it. I don't know. But that's what I was told. Nope, we didn't come before you know, because there's a lot of questions with that. We're putting all this money into a building, and I think, Mr. Poirier, you were the one that identified the fact that we don't own it, we don't have a lease over there, and we're just dumping all this money into that building. And then we find out later, oh, yeah, it did come out of taxpayer money. Probably 9,000 or more came out of taxpayers' money. And then the second question, follow-up question, is that, you know, the budget is still not over, you're still within your budgetary. So what didn't get done that we did authorize to pay for this project that we didn't authorize? And I got a lot of questions, you know,
Well,
about that whole project over
But
there.
To top it off, EMS is a tenant at will.
Yeah.
So we have very little at stake in the building, basically. It's owned by Lewiston, so.
And so all that to say, they put a lot of money over there. It looks really good.
They've been there for
It's-
what,
it's
30
been-
plus
It's a
years?
nice, it's been turned into a nice facility. I don't see them moving into the basement. You know,
Well,
I think
they-
maybe
well,
a year ago, that might have been a good idea, but
Well, you're probably jumping the gun there, because the basement can be retrofitted, according to this plan, that would look just as well as where they are now. They're in a basement. And so I wouldn't necessarily say that,
okay.
you know? Because it's a basement where they're at, and they don't have any windows. So it would be the basement over here, but if it was equally pleasant to work in a good environment, and there would be economies of scale savings in the future because of more consolidation, that would be even better. So I'm looking long-term here when I'm making a decision. So. Yeah, I'm
Deanne,
still
what are we
open.
asking? What are we
I get,
asking?
that's what that's,
I'm still open to this plan, until I'm really convinced that for this reason, this reason, this reason, we shouldn't go ahead with it. And right now, I don't know.
Plus, I think seeing it will, you know.
are we ready to
Seeing it is
put
one thing,
the
but imagining
recommendations
how
of
it
your,
would be afterwards is
Yeah.
another thing. You know, so.
are we ready for next meeting to put the recommendations, to have a presentation, the recommendations of your
Well,
committee?
It will be helpful if, and I don't know if I missed, if you get that, what I've talked to the Realtor about was being available to meet with us in executive session to discuss the options of a purchase of a property. He's agreed. The seller knows who we are, knows what our intent is, knows probabilities. We gave him every option. So at that point, we'd have an executive session to present a proposal to you. And if you want us to take some sort of action, we would need to come out of executive session with your authorization, an affirmative vote to do it. And again, I don't know the process of this bonding thing. I just know that it's something that apparently has to be done. So I don't know how that affects the options. I just know it gets done. That was a concern to the seller. But, so the next day would just be to present the property. I've got the engineers, I've sent them over the blueprints to it. I told them what our desire was as far as repurposing the property. It's not big enough, it's only 12,000 square feet. And where we would like an addition to go, and hopefully we can have a meeting to, get that under wraps to make sure the building itself is suitable. But that's what we're looking at. I think the ARPA thing is an intriguing option, if that's the way you choose to go. We should at least know, so you know what your options are. That's my opinion.
Clarice, is 2 weeks adequate for you to look into it, make some phone calls or whatever you need to do to have a
Yeah, well, my hope
comfort?
is to actually get it in writing writing, so I'll be sending, they provide an email, and I'd like to have it in writing. I'm in the process of writing it up, because I want all of the reasons why we think it should be covered. I should have that out tomorrow. I can never say when the treasury will get back to us, but.
So we have to go back to like the original, when we first got this place inspected, where it was kind of like, wow, you don't even have a public access place to meet with people, you got hallways. So there's all kinds of little things that are actually big things in other people's eyes that we want to make sure, we want to include. So, they don't know it yet, but we'll all be fishing for the ideas to kind of think back to where were we when this all came up,
So at least then we would have more information and other options. So we're looking at everything at the same time equally. Does that, we put that on the agenda for next meeting? Does that
Well,
suffice where
agenda-
we're going?
An agenda item for an executive session. Or are we talking your project? Or are we talking?
The executive session would be just to go over the negotiation of a property, if you guys are willing to consider that, because we found a property.
I know, and you'll have firm numbers as far as the
Well,
whole
we can
cost?
tell you the asking price, and it would be more about starting a negotiation. What would be helpful to know if ARPA funds are available, and if they're not, it changes the tactics for everything, to be
Right,
honest
and
with
it's
you.
not just the purchase price that's the cost of renovation, the cost of retrofitting, the cost of moving.
And that might be, if we're lucky, we can use the ARPA funds to purchase the property, and then maybe go out to bond for everything else. But we can't, this has been kicked down the road probably since the 1990s, when the new jail was built, and the old jail was supposed to be renovated for the sheriff's office, and it never was, and they put them all in the basement. And they kept putting up walls and doors and renovating different areas to have what you have now.
Madam Chair, another item that we have here, I'm not sure if it's on the agenda, but I know we have this paper about the American Rescue Plan Decision and Action Plan draft that was drawn by, I think it's from you, Larry.
And Sally also did one, and I haven't had a chance to look at hers yet. We'll sort of combine the,
Mine isn't
Two.
quite as far, mine is more just, I put down, and it's off subject here a little bit, but just put down how I was going to go about putting together a draft and the things I was going to include in it.
And I guess the bottom line on this particular one, I guess, is where I'm going. When we ask Clarice to, it seems to say, what I understood, major requests shall not be approved until the decision by the House of Representatives whether to allow up to 10 million per projects. So it's kind of the egg and the chicken here. We're in 2 weeks, will the House of Representatives make a decision? My understanding is the United States Senate did, but the House hasn't. So we have I'm not sure you can, I guess I'm looking at this, I'm thinking you're not gonna have an answer for us unless Congress acts.
Well, if we word it right, and we can meet all the needs of the original grant, that 10 million won't.
Okay, so if we go back to the back of spacing
Right.
The things that that Eric referred to as. Well, the other issue, yes, it just dawned on me, in working with Harriman, we could also present to you the numbers of properties that were identified and where they rated. This was was it the top highest rated or the second highest rated? This was probably the second highest rated property of all the properties in Androscoggin County. That was quite a bit of work with Harriman. I don't know how much detail you want into that, but pretty much I looked at everything for sale, and we also gave them places to pursue that weren't on the market to see if there was interest in selling. So that could be part of, or you can just take our word for it, that we went through an extensive search of everything available.
So there'd be plenty to present, not in executive session,
Yeah.
and then just only the.
I haven't checked with Harriman if they'd be willing to show up, but part of the deal in the contract we signed with them is they would show up when requested to present to the commissioners. And I did tell him, I think the commissioners should know that we did look at a number of properties, but we've eliminated, and at the same time, some go off the market fairly quickly.
Okay.
We'll give you whatever you want.
Eric?
She's
cracking down on you.
Okay. Yes.
Okay.
Go right ahead.
So Dave and Larry, what are we expecting them to? We're telling you we have a lot of questions, or at least I feel that's the general message from this group. What is your plan of coming back to bring us back to that comfort zone where we feel better about our decision? What is the next step? I
I
mean,
think the next step, what I'm gonna have to do is get the architect on board, actually draft up something better than the highlighter, and then have them do a cost breakdown so you can see what the actual remodel would be for that basement area.
okay.
Which is what I think I would.
Really
ask
appreciate
for.
that.
Okay. And with that, you'll give us square footage? Okay.
But
And
again,
because,
This was
Ed-
never put in to replace the sheriff's location. This is to fix the basement.
correct, and I understand that. I'm not trying to, I mean, all these things intertwine. You can refix the basement, but we have some people not living, but working there now. So we do have to be considerate of them, but I understand what you're trying to say. One of the things when you do that, because it was thrown out, EMA's square footage in Lewiston versus the square footage that's down here, I would love to just know what those two numbers are when you come back.
If you direct me to do that, I can do it.
Well, I think that's what somebody.
Do it, do it.
If Dave says if you force him to, he will. Madam Chair?
But this really, this conversation has helped because
Yeah.
this is,
It's much
this is
more-
exactly the questions that are being raised is, that is not an HVAC replacement
Right.
number.
Right. This was
And that's
going
what I've
on-
been being told, is that it's not, you better look into that more, that's not the right number. So this conversation has been very helpful to know that they are right, that wasn't
Right.
the cost of the HVAC system, that's the cost of
Like
a
removing the
whole.
boilers wasn't just removing the boilers, it's removing the boiler room and the smokestack. So that is a huge cost as well. So I don't wanna abandon the steam lines, the steam pipes that are just there. We're gonna remove the steam pipes, we're gonna remove the boilers, remove the boiler plant, remove the chimney, and then we're gonna put new boilers in this building. So there's a lot of change.
Who's
that we're
gonna
doing.
remove that?
Contractors, not me.
Yeah,
We have to go to bid.
because that's asbestos, I'm pretty
No.
sure.
Nope, there's no asbestos down there whatsoever. All that was abated sometime in the early 80s. I got a big book that says where and what, but
What if the boiler building was just mothballed?
then at some point, it's gonna it's gonna run down and the county's gonna have to be forced to remove it.
Can we have just a cost on that project
Right? Yes?
as another alternative, alternate? Because if we're not gonna use this fairly small footprint, and if the cost, there's gonna be reasons to spend money. And I'm looking for those reasons.
Sure.
All right.
I just don't wanna leave something for somebody else to have to tear down.
Hey, don't worry, we have a basement here, and we're willing to let that go. So the stack is secondary as far as I'm concerned.
But for example, the 1969 jail, that, when we built the new jail, we left the old jail. It was just left there, forgotten about. The sheriff's department was using it for storage because they had no storage. And the next thing you know, it's been an eyesore for 30 years, and then the commissioners finally decided to remove it. But then they didn't budget enough to pave it. So the sheriff's department was stuck with gravel because they didn't actually finish the project.
But
And
that old jail that he's talking about, that's now a parking lot, that was supposed to be renovated for our offices. And they
Right.
decided to cheap out and not do it, and I think that's how we ended up with carpets in the bathroom and the
Yes.
basement.
And that's exactly what's happening. Throughout
There's
all these
extra
years,
material.
the commissioners have skipped finishing projects. And that's all I'm trying to do, is like, if we're gonna start something, let's finish it.
Yeah.
If we're gonna leave the boilers out, let's finish it. We're not gonna ever use the boiler room. It's down in the ground 10 feet.
And I think you ought to look into the asbestos more. When they abate asbestos, they encapsulate it.
The pipes have fiberglass insulation on it with ACE. I used to do insulating.
Okay.
There's no asbestos down there.
Remove that room, you need to get DOC involved as well, because we need to create a barrier for the
Yeah,
child.
that's already in the specs that they have.
I haven't seen it, so you need to do something that DOC would have to approve.
Yeah, that was my next question.
Create.
It's in the
point-
paperwork right there.
Yeah, no, say that again. I didn't catch
That
the whole
room is
statement.
removed, that's one of the walls, there's a space there to the outside backyard, so that creates an area where you would need to create either razor wire in between or what's called dead space of so many feet. The DOC would have to be involved in that security barrier. That way we can walk up to the rec yard and throw things into the rec yard, so we need to create some sort of void in there.
So it may be better just to leave the building.
Well, right in your paperwork, it says a double fence.
So the building serves a purpose more than
Same
just,
with a double fence, there has to be space in between,
Sure,
so
yeah,
the
but-
razor wire
Yeah.
is gonna be, so you could remove the building, but you would create the appropriate.
It may be better to keep the building space.
I want the cost of that, of
Yeah.
removing the building.
yeah, well, that's yeah. If we have all the information, we can,
Make a better decision.
yeah.
Yeah.
Okay, so you have you're all set with,
Got it.
get this put on the agenda? So that we can look at,
To see if they're willing to come or I've actually got their thing on properties we looked at and eliminated. Yeah. And we can, as far as moving forward with the property, I make the recommendation to go into executive session because we can bring up some things that were discussed yesterday, pros and cons, get everybody's feeling, and if we should pursue.
so we'll have things we talk about outside of executive session, then when we actually start talking about acquisitions, okay, so both of those will need to be on the agenda. Okay, anything else on this before we move on? Well, I think we have a motion and a second to pull back on this project a little bit. We probably have to vote on it since we voted the other direction last meeting, unless there's other questions or other comments. Okay, all in favor? It's 5.
To reconsider.
Yeah, just to pull back a little bit, more information.
I have no intent on stopping the heating and cooling in HVAC
Right,
being
right.
rebuilt. That needs to
I
happen.
want to go back there, I don't know.
No.
That needs to happen.
Okay, anything else as far as ARPA? Yes.
When will the, when will we start accepting bids for the HVAC?
Not till end of summer, if not.
In the summer? And how's that work?
Maybe July, August.
And then, how's it work? Before that, you put out specs so people,
The
so the
architect
public
and
can
engineer
bid?
are working together for the next 6 months, meeting here quite a bit, to figure out what exactly we're gonna be doing here. So,
Great.
at some point, probably just before Christmas, they wanna send a team in and just figure out all the measurements, look at everything, look above the ceilings, just to know exactly what they're getting into.
That's in the next couple of weeks.
Yes.
Yes, okay.
Everything's been moving forward, since you guys gave me the green light,
Okay.
All right.
But you move forward on that, and it'll give us more information, and we can know that that's exactly.
they have to do their homework before they even start anyways, so it's not like that time will be lost.
Thank you.
All right. Anything else on ARPA? Okay, the sign,
Chair.
yes.
What's the posture of LA Museum and Journey House and that? Does that have to be placed on the agenda? Or how does all that work? What's the posture of that? Is any of it on
I
the
think
posture?
right now, we're just sort of collecting, as far as I know, we're just sort of, but I know that you have a letter from Leeds in your packet that Mr. Post put in, where they're sort of getting, like, we've been wanting to wait and collect all of the requests, but they're getting under the gun where they've got to know, to get matching funds, they've got to know what we're going to do, and they're, no.
The broadband.
The broadband for Leeds.
Contribution to
Like,
broadband.
they're not eligible for some of the funds that they're needing to do this unless they have partners on board with them. So you can read over that letter, and we're going to need to talk about that.
Now, when they say by January, do they mean by January 1st of 2020? Do we know that answer? 2022.
This next January, yes.
They want to know by the beginning of the month. So we don't have any leeway into the month.
No.
Okay.
Yeah, I see what you mean. They didn't put it, January 15th. They
Yeah,
didn't
you
put
know.
it- Yeah, they didn't put. they
Yeah,
just put
they're
January
sort of
2022.
under the gun to, at least know one way or the other. Now, I mean, if the decision of the board, when we look at, a process of going forward is, what was the date? I think you had said April is what we had some conversation talking about collecting things till April.
Having a.
Then that's the answer we give is, we're not saying we don't want to help you, it's just we're not making those decisions till April so
It's-
everyone can get their requests in.
Yeah, because if we do that one, then we're just
Right.
saying, too bad everybody else wait.
However, I think to your point, probably the Journey House needs to know before April also, don't they?
That was easily the smallest
Yeah.
amount by a lot.
Sooner the better. I'd just like to keep them on their feet.
And they were 10,000?
Well,
What was the request? Yeah, it was
Five.
like,
it was only 5,000, I thought, but maybe it was more. Okay. 10.
They were at 6,500 in back rent, if I remember correctly. Right. Sorry, Roland, take it away.
Well, I guess I'm looking at what Larry created and what you created also.
Yeah, mine is just a draft of how I was going to create it, so he's farther down the road than I
Yeah,
am.
but with Sally and, I think we need to put these two pieces of paper somewhat together.
Yep.
Which will help us define how to answer those other questions and also get those so that we can explain to those because like now, we get their presentation and they all want to know when we're going to give them an answer, and we don't know.
Right.
But we've got to prioritize, and then I think the other thing, which I haven't read enough of this yet, but we have to give a deadline because if we don't stop taking requests,
Correct.
this will continue forever before we can actually say,
yeah.
because, I hate to put a deadline, but the reality of it is, but I think we need to make it public that the commissioners are accepting proposals that are, qualifying, but, with some parameters from organizations, but we need to give them an adequate time, be it April, be it March. I'd hate to go further than April,
I think I prefer the deadline to be in March sometime, and then give
But-
decisions by
but I
April.
don't know. John, I think that's what I want to answer your question, but I'm saying if we can build this first, then we're treating everybody equal as best as we can. I'm sure,
And to be honest, is just an outline draft of how I wanted to put it together, and then I was hoping you all would be emailing me in the next 2 weeks and with your ideas of how to fill in those blanks, and that's exactly one, is dates, and how to set those, where you think is good for those due dates, and so that we can have a couple of drafts to bring forward at the next meeting and
Yeah.
decide. So I looked online too at some of the processes that the towns and even outside the state, and they're all following pretty much the same outline of, stating what it is, how they're going to evaluate the appropriateness of the request, and then, taking presentations.
The last thing you want is chaos at the last minute. And if you don't do planning, you're gonna get chaos.
And we're a little, I think we got a little ahead of ourselves with, spending some of the funds before we actually had a plan. Commissioner Medora actually was on a path to do that, and we did not follow through with that, so.
Can we set a deadline?
well.
If you
I
want to
think we
start emailing me your ideas for deadlines, I'll make that draft and I'll drop them in there, and then you can decide at the next meeting, what you want to do with it.
Does that work for you, John?
Yeah, or we could just put something on the agenda saying, decide the deadline. Hash it
Yeah.
around next meeting.
Which is always fun.
Well,
Rather
because
than
I think
emailing
your
them
question,
ideas.
I think your question tonight is very real. 'Cause
Yeah.
those organizations that have come are asking us to make a decision.
Right.
And I don't want you to think that I don't want to make a decision. I just want to try to organize how we make that decision.
And I know with leads, we may not be able to act by their deadline, but at least we should be upfront with them and let them know what the process is, so that it's just not always hanging out there,
I-
wondering when we're going to get back to them.
I'm not real big on their January deadline they gave us.
Right.
I don't like being backed into a corner on things.
Or we can decide whenever we want also. It depends on how we feel about the project, because we never really discussed the individual requests yet. We just received information, presentations. That's up to you, Madam Chair.
We need to get back to the agenda.
Yeah, I would be more comfortable
agenda?
if we had a plan and deadlines, and instead of just, how about this, how about this, how about this, and I feel like we're gonna, and then set them up, have a plan, and then a deadline, and then prioritize the projects, you know? I mean, I think we all know that the HVAC is a priority, because either we do it with ARPA funds, or we go out to bond, and with this money going out to bond would not be.
Well, I'm with Brian. The HVAC has to be done.
It does, it does.
I mean, I'm in no way, shape, or form
Um,
getting us away from doing it.
The signing authorization of the opioid lawsuit. Let's turn that over to Mr.
All of that information has come to me over the last couple of years, and it all comes into my computer, and quite frankly, the lawyers are gonna tell us if and when to settle, and bottom line is, what do we know, because all of it's a national thing, and so I guess I would request that you authorize me to be the signer of the lawsuit settlement that our attorneys tell us to go ahead and do.
Motion as to what,
I move that, Madam Chair, I move we authorize the administrator to sign off on any opioid lawsuit settlements with his, taking the advice of the attorneys.
I'll second it.
okay. Any other discussion or questions about that?
My only discussion would be, keep us on the loop as time moves on.
How many billions we'll get?
Well, yeah, well, not so much billions, but,
I heard we're getting 20 million,
$2.
$2 about what?
because if I remember right,
Ed's
you
gonna
also
know
spoke
this.
earlier that the state of Maine was trying to somehow get ahead of us, even though they weren't part of the lawsuit.
Yeah, and
Okay. And that's why I asked that you keep us in the loop,
Sure.
please. I don't agree with that, and I want to know about it.
Fun to read it in the newspaper and think, oh, boy, I should have known that. Yeah, for sure.
the bottom line is, when we get if and when we get money, I'll say if and when we get money, there's gonna be stipulations on it. You're not gonna be able to just expend it on money that we've already spent on the opioid system problems, but it'll be locked down pretty tight as to what we can use it for, so.
Yeah. No, I understand fully. I ironically received a check this week for $70.63 for a car that I owned 10 years ago. They finally settled.
So I hope you felt good about it.
I mean, I sold it 10 years ago. I owned it before that, but I sold it 10 years ago, and I got my $70.
That's life-changing.
And
All
63.
those in favor of authorizing the administrator to sign on that lawsuit? Opposed? Okay. Acceptance of the forfeited assets, are we going to you for that, or the sheriff, or, okay, Deputy Chief?
Hello.
So there's a letter before you from the Attorney General's office, just getting your approval so we can accept $942 in a Glock firearm that was seized during a traffic stop back in September of 2020. There's two co-defendants. One has already pled guilty. The other one's still pending. But this is just a preliminary, giving you, authorizing you to receive it once the courts finalize it. So,
Are we talking, when they're two separate things, are we talking about one pistol or two pistols?
no, it was one pistol. There was two defendants.
Sorry, I
So
should've
there was
said I
there was a
couldn't.
traffic stop. Both parties were in the car together. A little over 1.3 grams of methamphetamine was found in the car along with a gun. And the gentleman had the $942 on his person. So that was seized along with the gun and the drugs. He's already signed off on the forfeiture. He pled to it. The female's still pending in court. So this is just the preliminary part of, once the court finalizes it, you're saying you'll accept it.
I move to approve the acceptance of the forfeited assets, CR 2019-82, CR 2019-83.
Second to that.
Second, Roland.
Oh, he even states his name after.
Fancy.
Any other
questions or
motions last
discussion
week,
about
last-
that?
2 weeks ago.
Okay, all in favor? Opposed? Thank you.
Roland's always grandstanding.
Oh, okay. Discussion items. I've had some things here. We've already discussed the action plan that came up with something else. I did upon a piece of information that has brought up 20 questions in my mind, but I want to pass it along to the commissioners. I don't want to be the only one in possession of it. I did not make the phone call today to confirm, but both the jail administrator and the sheriff are here, so if I'm wrong, stop me right away, because yesterday, is it correct that yesterday, the third floor of the jail was between 90 and 95 degrees?
It was it the second floor? Second floor.
Floor?
It was better than this 50 degrees in the previous week, but we'll give it somewhere in between we're shooting for. It should all be resolved in hopefully the next few weeks.
I guess, yeah, but I get, the big
Why, because
question
we're
of that
changing seasons, or
is-
we're fixing the heat?
Yeah,
We've been waiting for parts to come in for quite some time, for the main controls to come in and finish their install for the new controls.
who's the vendor on that?
Main controls?
Because that was in, not last year, because we had a tight budget last year. That was like 2 years ago
Trying
budget.
to get them here ever since, and we're not the only ones. A lot of other customers are in the same boat, trying to get main controls. They just took on more than what they could handle. And then through the pandemic, a lot of the guys quit. Four of their top programmers quit, started their own business.
Yeah, this would have been before. Pre-pandemic that this was.
Right, but we were on a waiting list then, and because of this, their waiting list extended. So when they started ordering all the products, they couldn't get the products. So they came in, changed out all the valves, then they needed little computer controllers to operate the valves, and they couldn't get them. So that's what we've been waiting for.
Pre-pandemic, they couldn't get it? Right, but this would have been from 2 years ago budget.
No, it wasn't that long ago, a year.
Last
now.
year's budget, we cut everything really tight.
This time last year.
Was it? Okay. We started this project during the pandemic or before the pandemic?
This time last year, last December.
But the funding, I think Sally's saying the funding was given to you pre-pandemic, was it not?
I don't know why 2 years later,
Well-
on probably the coldest day, we're paying for fuel to heat and then take away the money. I mean, just, and I don't know about the jail, and we got experts here that, so I'm talking in front of experts, and I shouldn't do that, but in my mind, the problems that causes with frustration and for,
Executive session, so.
I mean, tempers and people coming off addictions and that kind of a circumstance. I'll tell you what my concern is that had offices in general government been 95, it probably would have created more of a stir, and I hope we're not the organization that just because they don't have a voice, that it's happening.
We didn't neglect it, we didn't wait on it. As soon as we found out about it, they went up to take care of it.
And when do you feel like it's gonna be fixed?
Hopefully the next couple of weeks, they're showing up tomorrow to start the next step.
You feel like the whole thing was just the
Again,
parts?
I can give you more details, but we have to go to executive session.
So it's more than just parts?
On this issue with the 95-degree temperature, yes.
Well, just so the commissioners know that it's information that came to me, and I don't like to just sit on that being the only person that knows it, because that's at least in my mind, that's a pretty serious complaint, especially where we've invested so much money into correcting it, you know? And I thought it was 2 budgets ago, but,
Can we get sued for that?
uh,
You can get sued for everything.
That's why it worries me.
But I mean,
For high temperatures?
I don't want to put you
It
in a
is a jail
bad
standards
situation, but you wanted to,
Jail standards violation, and all the issues you brought up about the population, it's true. Dave did send someone up to change the heat. It does take a long time to bring that heat back down now because of that building either. So yeah, it creates a lot of issues. I'll be very, very, very happy when this job is done. We do have complaints from inmates about the temperature. We've answered it. They can go to the state and complain, and we would be in violation. I think one of the commissioners said, could we be sued for it? He's right, we sue for anything. But it is a mandatory issue for us, so we're very much looking forward to having it done.
And I think your confusion with the budgets is it was in the 19 budget, because the jail budget starts late. It wasn't until December or January. So why it went as late as it did, and whoever made the decision to steal it, it's not helped at all. We should have just let the system fail and put in more. Because it's caused numerous problems throughout the year where I hear it from Jeff and I should pass it.
Yeah, you know, we're staff, our masks 12 hours a day. Plus they're hot, you know, and the inmates are hot and fighting or cold.
And
So I
our-
did order a bunch of new blankets. I got like 300 blankets, so we do have that dip. I can give extra blankets out.
And our population is back up, so when you talk about, what you're talking about is the psychological effects of unpleasant conditions. So when you have it heated or too cold, and the population's at 140, we have the capacity for 160, and the congestion, and there's no activity because of COVID issues, and you add factors like this, it doesn't help to control the inmate population. But we haven't had any issues.
No, last Wednesday was 56, I think, in minimum. That was, you know.
but just that there, you're talking about COVID, and then you're talking about 56, and then it's 95, and I'm not trying to make a pun, I truly am not, but that is a hotbed for virus and disease. And when we read in the news what's going on down in Cumberland Jail, it's got to be a priority, like, right? And I mean, if parts are the reason, you're saying parts are the reason. Well, how's it explain, your buildings?
They're waiting for parts. They're waiting for the controllers to come in. I had to push for them to show up to do the valves, which was back in May, because we had water leaking everywhere in the mechanical rooms, from the valve packing leaking everywhere. So, because that was a different department, that was mechanical services versus main controls, they're sister companies. I was able to get them in and change out the valves to stop a lot of the leaking of glycol on the floors. That happened. I was able to get them in to insulate all the piping that they did. That was done. And I know it sounds like it's piecemeal, but it was a lot of me pushing to get things to stop quicker. So it wasn't done in phases intentionally. It was me pushing the contractors to show up. And they show up, they do a piece, and then we come back and do another piece based on me pushing. And this last one is me pushing for them to show up and stay.
So the parts are available
Parts are
now?
all here, on site. They're showing up tomorrow to start unboxing and figure out what goes where in the building. Tomorrow they start to put together the puzzle. We'll walk them in.
Yeah, please,
We'll put
very
that on
high
the in the minutes,
priority.
please.
That was really, that was very, very high priority. It, well, you know, if it's parts, and you're saying parts is the reason this
Why it
went,
took so long? Not for the 95-degree issue. That was something totally different.
what's,
Like I
We'd have to
said
go into
earlier,
executive session.
executive session if you want to discuss that more and further.
that's not on the agenda today, and so my hands are tied. You know, I think it's a potentially really serious situation that happened. I'm not trying to overstate it, but I think it can't happen. But, okay, we do have an executive session, and it's one that I was not informed of, so I'm going to have to just go with what's on the
I still
paper.
have discussion.
Oh,
items,
okay.
If you're done with yours.
Yeah, yeah.
Discussion items, we need to vote for the sheriff's 2023 salary.
Thank
By
you.
the end of the year. I put together a list of the 16 counties, their salaries for their sheriffs, including Worcester, Auburn, Battis, Canning Falls. The median for the salaries, the median for the top 5 by population. I'm going to request for the next agenda for the sheriff's salary to raise from 2023 to $95,000. Puts him in the median for the top 5 by population. Still leaves Cumberland well ahead, but I think it's a much more fair number than the current 80 he resides at. And I'd like to get it on the next agenda.
Okay, this is good information. Thank you for putting the work into that. And we will make sure, and this actually has to be decided on
Has to be done by, at our next meeting.
by the end of the next meeting for
But
statute.
you're compiling this, that will make the,
Make it easy.
Yeah,
There's no
right.
favorites here, it's based on numbers.
right, yeah,
That's
well done.
very good information. Thank you. Did you, any other discussion on this, or you just want to digest it and discuss it next week when it's
Well, in 2 weeks, but yes.
next week?
I didn't expect a big discussion tonight, I just want to get it in front of everybody and give them the information.
I don't have any questions.
Okay.
And all the populations was done from the 2020 census that just took place.
Okay, any other discussion item? Okay, then I would entertain a motion to go into executive session. Oops.
Going on
Oh,
there.
oh, you got something going on. Oh, future agenda items. Yes, sir. Go ahead.
So I'm planning to have day 1 of 3 of the days to amend the bylaws next meeting, so this makes it really 4 days. But I wanted to just pass this out in case someone had input or ideas or wanted to make a different suggestion. And this has to do with Section 37 of the bylaws, which says, Section 2, all minutes of the commissioners will contain the wording of the motion and the amendments, as well as the names of the commissioners casting positive and negative votes. A commissioner may request that the commissioner's name be included with a minority vote, along with a statement giving the reasons for the commissioner's vote. And that's been used to have statements made after everyone has debated both sides of an issue. Then an additional statement is made after the issue is voted on. And I know of no deliberative body in the country that allows for debate to continue after the vote's been taken. Not city council, not legislature, not New Hampshire legislature, not U.S. Congress. So, yet, at the same time, I wanted to leave a way to have a statement made consistent with the way the bylaws are now, and so I want to change that to, Commissioner may request in writing that the commissioner's name be included with a minority vote along with a statement, given the reasons for the commissioner's vote. Such written request and statement shall be made via electronic text using email or by electronic medium delivered to the administrator. Get one to Larry, sorry. So in other words,
Request the minutes to reflect, it needs to be in a written request now?
yeah, like in Congress sometimes, you see people standing up giving a statement if you turn on C-SPAN, and then the camera spans, there's nobody in the room, because they're making a statement on the record, and then they can say, I stood in a congressional floor, made a record, blah, 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 blah. So this would be similar to that, where someone feels that the minutes weren't accurately reflecting his sentiments, or wanted to additionally explain why they voted in the negative, then they can submit a written statement to the administrator. It'll be published in the minutes. Therefore, the captive audience, known as the Board of Commissioners, doesn't have to listen to additional debate after the matter's been resolved. So anyway, I have to submit this by next Wednesday in 2 weeks, 2 weeks from last Wednesday, and so any changes, ideas, or whatever, let me know, and we can adjust that for the introduction, which will be at the next commission meeting.
So that does, so then they automatically would appear in the minutes.
That's an issue.
Wow. Well, when a statement is made now after someone, after the vote is taken, someone makes a statement, does that appear in the minutes?
As you know, there's been times when it hasn't, and I just explained to you why on October 20th that it didn't happen because the camera was shut off.
Right.
And so on. And I will also tell you that last meeting, it did not happen. And I was going to read why. Why that did not happen, because what we heard was the demeaning, disparaging, defaming, and degrading of the chair. And this being in conflict with Section 23 of the bylaws, we did not include it in the minutes.
Thank you, and that's appropriate. The Speaker of the House, for instance, will change the legislative record and the national record if something's stated out of order. So I don't have a big problem with that, but under this proposal, there would be a disc handed to you or an email, which you could then copy and then publish it in the minutes, but we wouldn't be interrupted by additional debate. That's the purpose of it, to allow the freedom of the expression, but without abusing the power or the rights that are stated in the bylaws.
Go right ahead.
Well, I thought it was kind of unusual that if you vote in the affirmative, you don't have to give a reason. Most of the boards you're on, if you vote in the negative, you don't have to give a reason. But if you abstain, you should give a reason. That is pretty universal. So I was surprised to see that we allow comments after somebody votes no. And I don't know where that first came out. I don't know if that comes from the state sample bylaws. I don't know if it's just our county that does this. But it was kind of weird to me that we allow people that just because they voted no, they need to defend their vote. I'm really questioning if that should continue. I mean,
Well, we'll discuss it when we.
I'm just saying that. It was kind
Yeah,
of.
we can, anyone's welcome to call and say, hey, maybe we should change this to this and this, and we'll present it in 2 weeks in the best form we can, and then we can also amend it in later meetings and vote up or down on it.
Because if we decide that, just because you voted no, you are entitled to put your comments in the minutes, then this is all moot.
if we decide that you're not allowed to anymore.
Right.
Yeah, that's one option, to just ban the whole practice altogether. I don't see it present anywhere else in deliberative bodies.
I don't know, it would be interesting to see what other counties do. Can you look, can you call a couple of other counties around and find out if commissioners voting no are allowed to have a comment inserted in the minutes?
I'd be good to stop it completely.
I'm guessing we're the only ones. But
Well,
I'll check.
Rather
when
have
we can.
facts.
we want to know.
And if you vote in the affirmative, if something is said defending why you voted against it, the affirmative people are not allowed to say something.
That's right, it's not equal
Right.
And
treatment.
I have seen, and I'm not talking about me and what the administrator did this week, and I appreciate it, but I'm not talking about me, I'm talking about other staff members and department heads. I have heard in that dissenting comment, some big bombs dropped with accusations that have been sort of left out in the atmosphere that were unwarranted. And what do? Because you voted in the affirmative, you can't step up and defend that
Right.
department
It
head.
gives more power to somebody who votes in a negative, which is that fair to those who voted in the affirmative?
I'm good with shutting it down completely, so there's no more comment.
I might submit two proposals, one to banish it altogether, and then this, which we could amend and play with, and then we can vote on one or
If we knew
both
to
or
need
neither.
to, yeah. But that would be good, to find out.
Discussions.
I've never heard of that.
One more future agenda, I think you already said it. We need to
have
address,
more
we told the
space.
sheriff's department we would recircle back on the salaries for the entire department.
That's all right.
That's, I've got that for next
Yeah,
week's,
I was just
next
making- I was just making
meetings.
sure. I
Yeah.
was just clarifying. Okay.
Uh,
I thought somebody said it, I just didn't remember who.
Lots to go on the agenda.
It's gonna be such a long.
Everybody, bring supper next meeting. Yes.
Are we, this executive session, well, never mind. Are we having an executive session next week?
No, tonight.
Well, we'll plan one, and we'll have something, I hope this is, I'm gonna paraphrase this right.
The only thing
Well,
I'm thinking is if we show you what we looked at for properties and identify what we're looking at, doesn't that kind of smooth everything out? So you might, and with your agenda, you might want to shorten it to, we can just go into executive session and talk about a property we identified. We can tell you the exercise during that time, so we can let you know how we got there. But if we did it during public, like you were suggesting earlier, like, wait a minute, we'll be identifying the property, which hurts your negotiations, if we even enter in. You guys might say, nope, not interested in that, and that's fine. But we'll show you, what we looked at, top three.
I just want to be really cautious, and you'll understand that, we make sure the executive session
Sticks to the property, and there was.
to
there was three-
executive
there were top
session
three
issues.
Identified, the top three are still available, and we can, I believe we're gonna be making a recommendation as to one, and how you guys, you might want more information, and that's fine too.
Madam Chair?
Yes.
I'd like to have an executive session next meeting so that we can get the rest of the story from Dave.
Yes.
Okay, so, that was sort of vague, so you're gonna have to identify, but you can take care of that with Larry. And, okay, any other, I don't wanna hurry you, this is your meeting. Any other, future agenda items? I have more than I could even fit in that little
Pretty
space. I think we're doing good. Okay, executive session to title, 1 MRSA, Section 4056, subsection C, and this is in reference to acquisition or use of real property.